Medicaid agencies are under so many pressures these days. The recession economy and high unemployment rate has driven up enrollment, and lower state tax revenues have put further pressure on agencies' budgets and expenditures. In simple terms, it's like having your household expenses increase by double digits at the same time that you get a pay cut. Medicaid agencies exist to serve the most needy populations. They are mission-bound to ensure this often vulnerable population has access to appropriate health care. To meet their objectives, agencies need to find ways to stretch dollars further without jeopardizing access to care and abrading stakeholders such as Medicaid providers. These days, change is constant for Medicaid agencies. For example, certain states are shifting lives from fee-for-service to managed care. Others are implementing federal waivers to expand their Medicaid population in advance of the healthcare reform requirements. And still so many others are grappling with implementing healthcare reform law provisions and preparing for a large influx in enrollment while facing uncertainty about the ultimate outcome of challenges to the law. HMS has been serving Medicaid agencies since 1985. We are focused on implementing third-party liability and program integrity solutions that help states manage costs and stretch their program dollars further. And, particularly with our fraud, waste, and abuse solutions, identifying improper payments not only saves programs money, but it often identifies when recipients are not receiving proper care. For example, identifying improper utilization can detect when recipients are being exposed to medically unnecessary treatments, such as radiation-exposing tests, overprescribed drugs, and other dangerous actions. Fighting fraud, waste, and abuse helps Medicaid agencies fulfill their mission to ensure vulnerable populations get access to appropriate care. And running efficient and safe programs is a good outcome of state program integrity efforts. For our team at HMS, it feels good to contribute to the process. State program integrity efforts are likely to be aided by CMS's willingness to share data and information across Medicare and Medicaid programs. Significant overlap exists for the two programs. They share a dual eligible population, have providers who treat both types of recipients, and the programs require a coordination with stakeholder activities, including fraud control units, the Federal Office of the Inspector General, state law enforcement, and other constituents concerned with identifying fraud, waste, and abuse. New efforts by CMS to share Medicare paid claims data, provider information, and program findings and activities will likely lead to better results and coordination across the states and CMS. And that's a very good thing.